Okay, hello everybody, good evening, and officially it is 8 p.m. You are, oh, okay, I see somebody with a hand up. Tony Balogun, do you have something you want to say, or is your hand up mistakenly? Please send me a message, Tony Balogun. I can see your hand up. Do you have a question, or is there something you want to say? Okay, so once again, welcome everybody to today's session to the DBT initiative. It's a health summit. We're going to be talking today on the prostate issues and bedroom department matters, how to handle these issues naturally. While we're having this session today, Father's Day is around the corner. Father's Day is actually next week, Sunday the 19th of June. And so we decided that we wanted to have this session today to celebrate all our fathers, to address an issue that is prevalent amongst men. And a lot of men, don't like to talk about it. A lot of women don't like to talk about it. But we said to ourselves, you know what, we want to talk about this. We want to let the world know, we want to let our men know, our men who are special to us, our men who mean a lot to us, our husbands, our fathers, our sons, our brothers, our cousins, our pastors. We just have a lot of men around us who are special to us. And we decided to have this session today so that we can actually demystify prostate issues. A lot of people, I reached out to somebody, and the reply he gave me, oh my goodness, I had to call him and say, oh, you went to school. How can you think this way about this particular issue? You know what, you need to be here on Sunday. Come and learn the truth about prostate issues and learn how to handle them naturally. So I don't want to go into, I don't want to waste our time. Our speaker is ready. She's my very good friend of many years. She's also, I'm looking for her. Please, Pharm, can you please put up your hand? I can't seem to find you anymore. Please, can you put up your hand so I can make you a co-host? I can't seem to find you. Can you please put up your hand so I can make you a co-host, ma'am? Where are you? Okay, so I can see a question. What is the time duration? We should not be here for more than an hour, maximum an hour, 15, 20 minutes, because we're going to be taking questions. There's going to be a question and answer session at the end of the presentation. We're going to hear from people as well, who our speaker is going to call up to speak to us and give us testimonials about what it is she's going to be talking to us about. I'm looking for her. I can't seem to find her. Pam, please, can you put up your hand? Can you raise your hand so that I can grant you co-host rights so that you can start your presentation ASAP? Okay, I think I found you. Okay, if you can hear me, please can you put up your hand from Olugbenga? Please can you put up your hand so that I can grant you co-host rights so that you can start your presentation. Are you here with me, ma'am? Yes, I saw her earlier on today. Please can you raise your hands, ma'am? Can you raise your hands? I can't find you anywhere. I'm talking about our speaker today. Please, can you raise your hand, ma'am, so that I can see you and unmute you, and then you can start speaking. Her name is pharmacist Wura Olugbenga. She's a pharmacist of over 30 years of experience, and she's going to be speaking to us today from her wealth of experience in dealing with these issues. I think I found her now. Yes. Okay, so her name is Pharm Olugbenga, and she will be presenting to us now. Yes, I need to be able to make her co-host so that she can share her slides with us. And that's why I need her to raise her hand. So if you're here with me, ma'am, okay, I found you. I've made you a co-host. Please unmute yourself and take us into this land of prostate issues and how we can make. Okay.
Okay, good evening.
Good evening.
Yes, ma'am. Good evening, everyone. Am I good to go?
Yes, please, ma'am.
Okay. Good evening, everyone. I will be sharing my slides with us so that we can just go on immediately. Okay. Are you seeing the slides? Are you seeing my slides? Hello?
Not yet, ma'am. Not yet, ma'am. But it says you have started sharing. So we're waiting.
Okay, ma'am.
It will soon come up. Yes. But I think you can start speaking while we're waiting.
Okay, my name is Olugbenga. I'm a pharmacist of about 34 years. And today we are going to be talking about prostate health and bedroom department affairs. I will try as much as possible to run through this so fast that it should be so easy for every one of us to understand about it. So I will be starting by talking about prostate. What is prostate? What is the prostate gland? The prostate gland is a gland in the male reproductive system. And we need to understand what is a gland because a lot of people may not even know what a gland is. A gland is an organ that makes hormones that are released directly into the blood, and it travels to the body, okay, to tissues and organs all over the body. So the prostate gland can be found in the reproductive system, and it includes the penis, the prostate, the seminal vesicle, and the testicle. That is the whole place. It's part of the reproductive system. It is just below the bladder in front of the rectum, and it is about the size of a walnut. I believe we know walnuts. That is what is called asala. And it surrounds the urethra. So the tube that empties the urine from the bladder, that is the urethra. Okay, this is the picture of what it looks like. And you can see the prostate here. That is, it's almost like a green small thing that is here. This is the penis coming here. You can see the urethra, that is the tube that from the prostate brings urine into the penis. And this is the bladder. You know, urine comes from the bladder into the prostate, and the prostate with a tube brings it into the penis. So when the man wants to urinate, it's like a small force is put on the prostate and the urine is released. Let's go on. Also, what does the prostate, what does it do? There are two major functions of the prostate. We have the primary function is to produce the fluid that nourishes and transports sperm. That is the seminal fluid. That is what we call the semen. This is what transports the sperm from the man into the body of a woman, and thereby bringing pleasure or production of children. So the muscles of the prostate also they ensure that the semen is forcefully pressed into the urethra and then expelled outwards during the ejaculation. And you know, the semen had to come with force because they're going to move in an upward direction, you know, into the body of the woman. And it has to come with speed. So force is needed to release the semen. And this is what the prostate does in the body of a man. Now, can you live without a prostate? The answer is nothing. And that is because if there is urine in the bladder, and there will always be, it will flow right through to the outside. It has to go to the outside. So the prostate is like the bridge between the bladder and that brings the urine into the penis. So it becomes a very, very important thing. So men without a prostate need another way to gain control over urination. So no, you can't really live without a prostate. You need it. But when it has to be taken away, there has to be an alternative way that will be created for urine to go out. What does prostate, what does it feel like? So that as a man, you can actually try to touch your groin side to feel what it is like. So the prostate is, if it's healthy, it feels smooth, while an enlarged prostate may be felt as a bulge. So when a person is actually having something like a bulge at the groin sides, then there is need for you to actually do something about it. Okay, if the prostate is enlarged, it will still feel, it can still feel smooth. And in the case of benign prostatic hyperplasia, that is the BPH, but if cancer is present, the gland may feel hard and lumpy. So when a lumping thing is felt, there is need to do something. Now, how do you check your prostate? How do you know if your prostate is okay? You check your prostate through one, the digital rectal exam that is called the DRE. And this is a test which your provider will have to insert a lubricated glove finger into your rectum to feel and to check, to look out for lumps or if there is anything that might be there. And also the PSA test. The PSA stands for prostate-specific antigen, which is an enzyme, a protein secreted, made by the prostate gland and found in the blood. So the PSA test can also help us to know the state of the prostate of a man. Now I have some figures here which tells us about how healthy a man may be. So you have the figures. We have the age range, the years, that is for 40 to 49, 0 to 2.5, 50 to 59, 0 to 3.5, 60 to 69, 4.5, and above that, around 5. So these are the figures that you will expect to see when you do your test. Anything outside or above these figures shows that there is a problem somewhere. Okay. How do you maintain a better prostate health? There are several ways that are listed, but number one way that everybody will tell you is that you have to hydrate yourself. And tea happens to be a very good way, most especially green tea and hibiscus tea. Hibiscus tea is what we call zobo. So it's actually very good for men. Then they are among the top drinks that is very good for prostate. So exercises and loss of weight will also help, because obesity can actually be a big problem. So there is need to do a lot of exercise and to shed weight. Then you follow a prostate-friendly diet. I will still talk more about the diet. You see, one thing I've discovered is that most illness or diseases that we have, diet plays a big part in it. Diet plays a big part, and there is need for you and I to actually begin now to work on our diet and to make sure you are eating right and supplementing our body. So friendly diet is also very useful. And then you take supplements. Men just cannot afford not to take supplements. You just can't afford it. So there is need for men to take supplements, and because you cannot get all the diets you need, from fruits or foods. You can't. And this is one thing we keep saying, and this because of the way our world has become. We plant things with manure, with chemicals, not even natural manure. If it's natural manure, fine, lovely. What we do now with chemicals, and so these chemicals are just not good. We are not getting the right nutrients we are supposed to get from these plants. So there is need to go for a lot of supplements. And then you need to reduce stress. You just have to calm down, because we know a lot of men are agile and a lot of them talk so hard. They are, with all due respect, but I've seen a lot of cases. A lot of men shout when they're talking, and this can cause stress. Apart from affecting your prostate, it can also affect your blood pressure and several other things in the body. And also, there is need for you to make a lot of changes in your lifestyle. Talking about lifestyle changes, a lot of habits, like I was talking about the way you talk now, there is need not to stop shouting. You need to stop shouting, and you need to stop getting angry. Lots of men get angry, even at age of 70 plus. You see some men will get angry, shout at everybody and all those things. It's time to stop such things. So you have to maintain a healthy weight. Speaking about exercise the other time, I mentioned the issue of healthy weight, which will help you as well. And you need to know your risk factors. There are risk factors, which I will still discuss risk factors later, so that you look at which of these risk factors affect you, and that will help you to be able to adjust yourself. So hydrate daily. We cannot overemphasize the need for water. We need to be taking a lot of water. It's extremely important. So how to maintain a better prostate health? What are the other things you need to do? Like I've said, you manage stress. It's still coming up again. Maintaining better prostate health includes managing stress. Then you have to stop smoking. If you are smoking, stop smoking. Smoking has a lot of hazards, more bad than good. It does much more bad than good. So you need to cut down or cut out alcohol as much as possible. If you can just stop taking alcohol, it's far better for you. And also processed foods are not so good. Then there is need for you restore your hormones, because it's not only women that go through hormonal imbalance. That's one thing we need to know. Well, it's so common with women going through hormonal imbalance when puberty is attained, but also men go through hormonal imbalance. So there is need for hormones restoration. So you get a prostate exam, each year, and told us how to do that the other time. So what problems can prostates have? Here are some examples of non-cancer prostate problems. We have the benign prostatic hyperplasia, which is the BPH, and this is very common in older men. It means your prostate is enlarged, but not cancerous. So also we have acute bacterial prostatitis. Prostatitis simply means inflammation of the prostate. So usually it starts suddenly from a bacterial infection, and attention is needed when you have fever, chills, or pain in addition to prostate symptoms. I would like to say something about this. The moment you observe that you have an infection, please don't just overlook infections. You need to go and see a medical person that will put you through on what to do concerning an infection. A lot of us underrate, let me use that, we underrate infections. So infections can actually create a lot of prostate problems for people. And we also have chronic bacterial prostatitis. It's an infection that comes back again and again. You know, I was talking about you treating infection the other time. So when a bacterial infection continues to reoccur, it could be UTI, urinary tract infection, or any form of infection that you have. But when you keep having infection and you have to use antibiotics, so you can have a chronic infection. And this is a real problem, but can actually become something big. And there is need for thorough detoxification of such a person with good supplements. It may be very necessary. And also, we have the chronic pelvic pain syndrome. And this is a common prostate problem for a lot of men. It can cause pain in the lower back, in the groins, or at the tip of the penis. A lot of men complain of lower back pain. Unfortunately, in our country here, we call it jedi jedi. But most people did not know that it's actually their prostate that started having issues. So treatments may require a combination of medicines, could be surgery at times, and lifestyle changes becomes extremely very important. So now, prostate problems still on it, there can be a bedroom department issue, that is your libido, when you have problem with your prostate. And the problem that normally comes out of this includes erectile dysfunctioning, that is the inability to attain and maintain an erection sufficient for sexual intercourse, at least 25% of the time. So such men just discover that when the erection comes up, before you know what is happening, it has gone down again. There is something wrong with the prostate when that begins to happen. You need to check it. Then when you are having painful ejaculation, I believe men here, you really understand, and everybody understand what I mean by ejaculation. So at the point of release of the semen, if you feel pain, you need to check. There's something wrong, because it's possible that the prostate gland is inflamed. And when it's inflamed, that is much bigger than what it's supposed to be. And you know, when you want to release the semen, it comes with force, like I told us the other time. So when it's coming with force like that, it can cause pain, Then when a man begins to have reduced sex drive and reduction in sexual satisfaction and pleasure, you need to check up with your prostate gland. There might be an issue there. A major question asked by men is, can I still have an erection if prostate is removed? Now, I will answer this way. The nerves, the blood vessels and muscles may be weakened. And when you have surgery for your prostate cancer, so when the prostate is removed, the erection may not be as strong as expected, or the man may not be able to have erection. So for a period of time after surgery, many men are not able to get erection, even though in most cases, this is restored back within some few months. It could be short and it could be long. Now, what are the causes? What causes prostate problems? We have the cause of prostate enlargement is unknown. Just like when we were talking about fibroid the other day, we discovered that it's unknown, but it's there, you know. It is believed to be linked with the hormonal changes. The moment puberty is attained in both male and female, hormonal changes comes up. So it seems this is a major cause that we can lay hands upon. Also, the balance of hormones in a man's body changes as he gets older, and this may cause prostate gland to grow, and also fat stimulates increased production of testosterone and other hormones, and testosterone adds to speed the growth of prostate cancer. High testosterone level may stimulate dormant prostate cancer cells into activity, and testosterone is still needed by a man in his body. So we just discovered that some of these things, as much as they are good for our body, they can also create an havoc for the body. Now let's look at the symptoms of prostate problems. Somebody that has it, what are the symptoms that you might likely be seeing? We have frequent urge to urinate. When you have this frequent urge to urinate, then you need to come for a checkup. You need to get up many times during the night, or you have blood in the urine or semen. Once you're seeing blood in your urine or in the semen, then there is a need for you to come for a checkup. Then pain or burning urination, it's likely to be a prostate case, though it could be urinary tract infection in some cases. Like I've said before, painful ejaculation, frequent pain or stiffness in the lower back, the hips, the pelvic, the rectal area, or the upper thigh. When you are having pain there, you need to check. This small walnut-sized organ might just be the one that is causing all the problem. And when you find out that urine is dribbling, you go for urination, you come back, and at the tip of the penis, you can still see urine dribbling, dropping, dump, dump, dump. Then there is need for you to check. Where do you feel the prostate pain? You feel the prostate pain around your groin, around your groin to the pelvic area to your thigh. That's where you feel it. And when you are having constant pain in this area, please do something about it. What are the risk factors? Risk factors include age. Men age 50 and older run a greater risk. A lot of people even have it from age 40. From age 40, it's very possible that a man will begin to have some feelings about the prostate, and there is need to check it. Also, race. Prostate cancer is most common among African Americans men, followed by Hispanic and Native American men. Asians American men have the lowest rate of prostate cancer. That means the African nature sort of promotes this. So Africans have more prostate cases than the white men. And I think this has to do with diet, with what we eat. It has a lot to do with it. Also, risk factor includes the family history. If your father or your brother had prostate cancer, you are more likely to develop it as well. So, or even if it's your great grandfather, once somebody in the family has it, you need to always check to be sure you are okay. Other risk factors include diet. I'm coming back to talk about diet. Diet plays a big part in our lives and in all we do. So also we have genetic changes, mutilation of the genes. So this can also be a risk factor. And eating habits. How often do you eat? How do you eat? Are you eating well? All these things can aggravate or give you a high percentage of happiness. So now, how can we prevent prostate? How can we prevent it? Although there is no proven way to completely prevent prostate problems or cancer, however, you can look at the following, change the following, adjust where there is need for you to adjust. Number one is still diet and lifestyle. Diet, what you put in your mouth goes a long way. There is no major sickness or disease that we will discuss that we will not talk about diet, because what we put in affects our body and brings changes from the natural state to the state of whatsoever you and I have eaten. And lifestyle also goes a long way. I was talking about stress the other time. What kind of lifestyle do you operate? Are you the type that gets annoyed, you shout, you talk? You know, even if you look at it, when you're trying to talk, if you are sensitive, you discover that as you talk, you can feel it in your private parts. You can feel a push right from your private parts. And that is one of the reasons why we need to adjust. Anger is not good. All the religions we have in the world does not support anger. So there is a need for us to adjust. And all of them encourage that you take a lot of caution when it comes to stress. Reduce fat intake. We need to caution on that, especially once you are getting to 40 years, 50 years, you just have to eat less trans fat and saturated fats. Eat more fruits and vegetables. Fruits and vegetables are very good for you. Then you have to add green tea and soy, that is soya, maybe through the soya beans and all those things that we have here. You have to add them to your food. Eat fresh, whole food diets. Spoke about fruits, vegetables that are full of phytonutrients and antioxidants. The antioxidants are extremely important because antioxidants deplete toxins and free radicals from our body. It is these toxins and free radicals that normally cause a lot of infection and problems. You have to cut down or cut out alcohol. I've mentioned that. Get more exercise, restore your hormones. I mentioned that the other time. So now let's go to treatment. How do we treat it? Now we have chemoprevention. After examination and certain consideration, a class of drugs is given. We call them the 5-alpha reductase inhibitors. And know some people that have prostate issues here already know these drugs. Avodat, we also have Duodat and all those. They are good, they are used to control, but this is using chemicals. So that's why they are called chemoprevention. And also when cancer develops, there is likely that you are put on surgery. They have to do surgery to remove the prostate gland. And the major third treatment is dietary changes. So I'm still talking about this diet. This is a major treatment and a very important one for us in Rain International. I'm still going to talk about it later. So now let's look at dietary changes. Dietary changes may need to be made many years earlier. We don't have to wait till the time we have a problem before we start adjusting what we are eating. That's what I'm trying to say there. Let's start now. Let's start using, eating right now. Let's start using good supplements now. This will help to prevent future occurrence of diseases and sicknesses. And there are many prostate-friendly foods, which I will still discuss later, and also that will help for both the cancerous prostate, or probably we just have some, it's not yet cancerous, it's just a problem. So fresh, whole foods, diet, fruits, vegetables, like I've said, they are still very good and will help us. Some of the best food for prostate health include oily fish that are high in omega-3 fatty acid. We have what we call the cruciferous vegetables. This class of vegetables includes things like cabbage, broccoli, kale, cauliflower, Brussels sprouts. We also have things like berries. They are also very good. So food high in healthy fats like avocado. Avocado is very, very good. And we have seeds, a lot of seeds. Walnuts is also a very good one. Nuts and also olives. They help a lot with prostate cases. Talking about this food, we also have the mushrooms, either Asian or Nigerian mushroom, American, but any name you want to give it. They are very good for prostate health. And also tomatoes. Tomatoes are very good, especially when they are slightly cooked, not too much. You can take them raw, but when it's slightly cooked, tomatoes are very, very good for prostate health. Then we have pomegranate juice. If you are living in a place where you can get pomegranate, lovely. They will help you a lot. And walnuts, we know walnuts, and it will also help us. Then dietary supplements. You just can't avoid this. You can't escape it. It's very necessary. For prostate health, in some other cases, you might say, well, I don't really need a supplement, but for this, you do need a supplement. Now, why supplements? Supplements are very good because sometimes you cannot get it all through diet and in consistent therapeutic quantities. Therapeutic quantities actually mean the quantity that is needed to bring a change to that particular state you're trying to handle, you're trying to treat. So the quantity needed. For example, if you are talking about a particular seed, maybe you want to use black cumin seed now, you might need a big bowl for you to attain the therapeutic quantity that will bring a change in your body. So therefore, it's better for you to use a supplement that contains it because it would have sort of been compressed into it. The eating will not be cumbersome. So also you might know that something is good for you, maybe like someone like me, I don't take cucumber because I have allergic reaction to it. But it's good. Cucumber is very good for the body. I just can't take it raw like that. So supplements contains a lot of these things because you just can't take it. There are some things you try to take it, but you just can't. If you force it down your throat, you will have to vomit it again. So some of these things are put in supplements.
Hello, Mr. Olugbenga, are you there? Oh, I hope we haven't lost her. Hello,
And
Mrs.
when you are taking
Olugbenga,
it,
are
you
you
not
there?
even
Okay, are
get
you
them.
back?
And
Okay, we didn't hear you
also,
for.
many men who are prostate take daily, it's documented that supplement. Now, just before, you didn't hear me.
Please go ahead. Go ahead. It was a bit. We lost you for a bit, but you're back now. Please go ahead now. Hello, everybody. Hello, hello. Okay. It seems we have lost our speaker, but I'm sure she will soon be back on. It will be due to network issues in her part of the country because she's actually joining us from outside Lagos. Okay, so she's back. Please raise your hand, ma'am, so I can, okay, I've found you. Okay, please go ahead, ma'am. Can you unmute? Please go ahead and unmute. Okay.
Okay, are you not hearing me?
Yes, please go ahead, ma'am.
Oh, I didn't even know I was gone. Please, where I have to share the screen again, or are you still seeing my screen?
No, please go ahead and share your screen again, ma'am.
Okay. It's not allowing me.
For those who are requesting for the recording, if you are a guest, it will be sent to you by the person who invited you to the meeting. And for those who are asking questions, please can you hold on? All questions will be taken after the presentation during the Q&A session. Please do not type your questions in the chat box so that it will not be missed. Please try again, ma'am.
May I know where do you want me to start from?
Where you started talking about dietary supplements, about
okay,
using the first paragraph on supplements, just after you spoke about the dietary changes.
Okay.
But please, before you go on, ma'am, sorry, please, before you go on, ma'am,
yes,
I just want to say this again. Please don't type your questions yet in the chat box because they might get lost in people sending in different chats. All questions will be taken at the end of the session. And then for those who are asking for the recording, please get back to the person who invited you to today's session. They will give you the recording when it is ready. Thank you. Please go ahead, Pharm. Thank you.
Are you seeing this, my slide?
No, not yet, ma'am.
Are you seeing my slide, ma'am?
No, ma'am, we're not yet. No, we're not.
Not allowing me to share. Should I just go ahead?
Okay, go ahead. Let's try and see why that is not happening.
It's not allowing me to share that. Yeah.
Okay, can you try again now, ma'am?
Okay.
Please, can we stop? Please, can we not post? No, ma'am. Yes, it's sharing now. Please, I would like to plead with us. Please do not drop your email addresses in the chat box. This is a public Zoom meeting. Please do not type your email addresses in the chat box. This is a public Zoom meeting, and we do not have any control of who you will be seeing your email addresses. The recording will be sent to you by the person who invited you to this meeting. Please ask the person for the recording and you will get the recording. Please do not post your email addresses or your phone numbers or any personal details in the chat room, please. Thank you very much. Yes, this was where, yes, please continue. This was where you went off, ma'am. Yeah, thank you.
All right. So I was saying, why supplements? I said sometimes you cannot get it all through diet because of the quantity that you have to eat to be able to get the therapeutic quantity. And I was trying to explain what therapeutic quantity means. That therapeutic quantity is the quantity of maybe a drug or anything that you need to use in order for you to have an effective change in that body. And also, there might be some things that you really don't like to use, to eat, and you might need them in your body. But when you use supplements, these things might be in the supplements and it will not affect your body. I use cucumber, for example, that I do take it because I react to it. But it's likely to be in some drinks, in several other things that I take, and it might not affect me at all. And I also mentioned the fact that supplements cannot be overemphasized as for men, because supplements have been seen and is well documented that supplements have helped men concerning prostate health. Okay, so I said before I go into the supplements, I would like to call on those people that want to assist me to give testimonial. I have Mrs. Nika Beresino. Unfortunately, I couldn't get men to come up to speak to us today. It's like most men don't like talking, but I have a lot of women here that want to talk on behalf of some of our men in the house. So I would like to call on Mrs. Nika Beresino first. So please, within a minute or two, please. Can we hear you, ma'am?
Please, can she raise her hand, please? Please, can she raise her hand so we can ask her to unmute? Okay.
Mrs. Beresino?
Okay, please please unmute yourself and go ahead, ma'am.
Okay.
Hello, good evening, everyone.
Good evening,
and thank
evening,
you, my able pharmacy colleague. Yes, I'm sharing this testimony on behalf of a schoolmate of mine. I think towards the end of last year, it took, he had some of the supplements because he had, according to him, he said his manhood was actually dead. That's what he said. But he said as he started taking these supplements, it was picking up. He started picking up and, so, and he said he hasn't had that feeling for, I think he said about 2 years. So, and this was within him taking a packet. So now, and as he said he knows that as it takes it regularly, he knows that there will be an improvement. And he also mentioned that even other parts of his body too, he can notice an improvement as well. So
thank you very much, ma'am. Thank you for that. I have also had a lot of clients when it comes to that, the bedroom issue. And the supplements have really helped them a lot. They've really, really helped them. And there was even a particular case that we didn't know it was a prostate inflammation that he actually had. So when he came, I had him to go for examination, and he did some examinations, and we started the supplements. And in fact, he didn't come back to give me a report. He sent his wife. When I called, he said, I know if my wife tells you that the supplement is working, you will understand. You will believe that it's actually working. So let me also call on my sister Yetunde. She also has some testimonials to share with us on behalf of some of our men. Sister Yetunde, please.
Good evening, everyone. Hope you can hear me.
Yes, we can hear you. Please go ahead.
Right, thank you. I'll be sharing 2 testimonials on behalf of 2 gentlemen. One of them I have not met, and I'll be sharing his testimonial first. He's a gentleman who came across our products that was being sold from my cousin's office in Lagos. And he asked if the products would help with prostate issues. And I sent him a testimonial and he ordered 2 boxes of our products. And within a couple of days, my cousin sent a message back to me that the man said, thank you to the company, thank you for the products, that his wife noticed a difference in the bedroom department. That's testimonial number 1. Now, the second person who actually shared a testimonial with me again was the person who introduced his friend to our products. And he just said, oh, he thinks that he's beginning to feel that there's something not right in that area. Would our products help? He also bought a box of soap. And I saw the gentleman a few months after I started using the products. He didn't say anything. He looked at me and he said, oh, Aburo, your products are helping you. Your skin is much better. But I also have my own testimonial to share with you on behalf of your wife. You know, we are Yoruba people, our cousins and our brothers' wives are our wives. So he gave the testimonial on behalf of his wife, saying that she too had noticed a difference in the bedroom affairs. So those are the kind of testimonials that we get. Thank you. And as we say, the men don't want to come and share their testimonial, so we share it on their behalf. Thank you very much.
You're welcome, ma'am. So, and like I said the other time when I was talking, I told you that prostate issues, they are the one that actually causes a lot of bedroom issues that we have. And as you know, that when there is prostate, it's possible for you to have blood in the semen, and of course that will affect the bedroom department. So these supplements have been used for a lot of things, and that will make me to talk about Rain International. Rain International is a health and wellness company based in Utah in the United States. In conjunction with scientists from University of Maryland and Johns Hopkins University, they created supplements with seeds and made them available in about 46 countries. They come in easy to carry and easily consumable sachet. Now let's look into this supplements. Some of the ingredients used in the production of the supplements include greens, dandelion, kale, spirulina, wheat grass, aloe vera, black raspberry, and we have the following seeds: black cumin seeds, milk thistle seed, Cadbury seed, and also we have the chandonari grape seeds. And if you were very attentive the other time when I was talking about the vegetables, I mentioned some of these vegetables that they are very good for prostate health. And I also mentioned that seeds and nuts are extremely very good for prostate health. So let's go on. All of these ingredients are put together in 2 important supplements of Rain International called Rain Soul and Rain Core. We have much more than these 2 supplements, but you're not hearing me again? Hello? Are you hearing me?
Yes, we can. We can hear you, ma.
You can hear me? Oh.
Yes, I think we have one more testifier.
Oh, one more testifier.
Yes.
Okay, can we have the person, please? Thank you.
Yes. It's a man. He has agreed to come on, but not showing his face.
No problem.
So
let's hear your voice, sir.
Can he raise his hand so that I can unmute you? Okay, I think I found them.
Okay.
Okay, please unmute. Please go ahead.
Good evening. My name is Anthony Ahomele. I am 82 years old, going to 83 by August. My only small contribution with regard to this prostate experience is that I've had this prostate surgery for the past 15 years. Now, it is important to state that I've not had problem with the prostate surgery since I had it, primarily because I think God helped me through the surgeon or the urologist who did a very good job, and my children who financed the project. And that was why I had no cancerous fallout from that experience. But taking Renso, since I had, but since for 12 years, I've not had any problem on my prostate. Now, but for the past 3 years, both my prostate and the arthritis of my fingers, which had really pained me for about 5 years before 2018, have been handled by this soul. Because when my daughter introduced this soul to me, it completely changed my fingers, my I don't know what to call it. My fingers are like monkey's fingers, clawing monkey's fingers. But now I can straighten my fingers for the past 3 years, and I've not had any issue whatsoever for the prostate. And I thank God for it. But God works through people. And I think God has helped me through this race soul. And I recommend it for everybody who needs to get some redemption from any affliction they have. Thank you very much.
Thank you so much, sir. Thank you, Daddy. We appreciate you so much for coming on.
Thank you very much, sir. We also have another hand up. Can you take one more?
Yes,
okay.
Yes, please.
Okay,
Yes,
please unmute Esther, Diamond Esther. Please go ahead and unmute. Your hand is up.
Okay, thank you very much. Yeah, my name is Esther Waye, and I would just like to share, in between 2019 and now, I've had 2 successful testimonials of people I helped with their prostate enlargement with the supplement. So the first was my dad. At the age of 76, in 2019, my dad was diagnosed with prostate enlargement. He was quite worried, being an elderly man, and the prognosis wasn't good at all. So it ran to me, and of course, the very first thing I could think of was to recommend the supplement. And I can tell you now that the last set of results my dad sent to me from his doctor is okay, is good. He hasn't got any of that issue anymore. In fact, since that time, his go-to supplement solution for everything health has been the supplement. He's living fine. He'll be 80 in January, but honestly, health-wise is just spot on. Then there's a friend of mine who ran to me in 2019 December with the same problem. In fact, I'm looking at the picture right in front of me, a screenshot of the testimonial he shared with me. So December 2019, I recommended the supplement. By January, the 4th week in January, is come back with an amazing testimonial of how the PSA level that was 7.9 since April of 2019, that couldn't come down at all with all of the medication, couldn't come down, had come down from 7.9 to 2.1. That was amazing. And by then, it has only been on the supplement for about 4 weeks. Amazing. Until now, it doesn't have that problem at all anymore. So yeah, the supplement works. Thank you very much.
Thank you so much, ma'am. Thank you. We appreciate that. So let me go on. I believe with these testimonials, you will know that these supplements are not just mere thing. We are not just saying it by mouth. You've heard from, I think we've had 4 people now that have given us testimonials on how these supplements have really helped a lot of people. I also did again 5. At least I have about 3 of my clients that I placed on this, and it has really helped them. So let me go on. The first supplement is Rain Soul. Soul is our flagship product. Soul was created by a team of doctors and scientists who are looking for ways to provide nutrient-dense food for children who are just gone through chemotherapy and radiotherapy. They discovered the power of these seeds that I will show you later when cold pressed and combined in a particular dosage. And these seeds are the black cumin seed, the black raspberry seed, and the chandonary grape seed. These are all the ingredients that are in Rain Soul. And Rain Soul has really helped a lot of people, not just for prostate health, but for general body upkeep. One thing about Rain Soul is that it is a very strong immune booster. It builds the immunity of your body. And you know that when your immune system is at the top of its game, then your body will be in good health. The immune system helps the body. When we were talking about immune system, I call them the soldiers of the body. They are the ones that fight for the body. They fight any form of diseases or infection that might come to your body. So Rain Soul is also an antioxidant. It also depletes toxins. And also Rain Soul is an anti-inflammatory. And if you remember when I was talking about problems that you can have with prostate, I talked about prostatitis, which is an inflammation of the prostate gland. And Rain Soul is an anti-inflammatory agent. So when you use it, it will help the enlarged prostate to come down back to its normal size. And the second product is Rain Core. Core is our second product and it's full of greens. For you to get all the greens in one sachet of Core, you will need to fill your kitchen with all manner of green vegetables. Can you just imagine that? If you have to sit down and we bring to you raw vegetables and you say you should start eating it, I'm sure the first thing you say is that, am I a goat? So that is where Rain Core comes in. Rain Core has all of these greens put together in a very small, you can call it a sachet or a pouch. So, and it's also a very strong antioxidant. It's purely and mainly an antioxidizing agent. So it has a lot of ingredients in it. You have the black cumin seed oil, you have the mint thistle, you have kale, aloe vera, and several other ingredients that are put together in Rain Core. So Rain Core has helped a lot of people, especially when you have cases of diseases that has to do with special organs of the body. Core have been found to be very, very effective and useful for all of these things. So if you are able to use these products, you will discover that they are going to help you a lot. These two supplements will help you to maintain very good prostate health and also take care of other prostate problems that you may have. Interestingly, several other health challenges you may have in your body that you don't even know of will be well taken care of by these supplements. Once again, I want to appreciate all the people that have given testimonials. I want to appreciate all my elites, all my diamonds that are in the house, all the executives, all members of Rain that are in the house. Thank you so much for giving me this opportunity to be able to share this with you. I appreciate you all. Thank you.
Thank you, thank you, thank you very much. Oh my goodness, that was an awesome session. Thank you so much, Wuraola Olugbenga, for that very inspiring session. And so because of time, we're just going to go straight into the question and answer session. Please, if you have a question, kindly raise your hand. I would ask that we try not to type in the chat box or the chat room so we do not miss your question. That was an amazing, amazing session. I learned so much. I learned so much. Thank you to everybody who gave testimonials directly. Daddy Ohomele who gave a testimonial. Wow, at 83, he's still waxing strong, no prostate issues. That is really awesome. Thank you, Esther Weyer, for that awesome one as well, for your dad. You know, when I hear of these men who are waxing strong at these ages, it's just very encouraging. So please, if you have any questions, kindly raise your hand so that we can start calling on you. Okay, the first person I have here is Ayo Ajibola. Please, can you unmute and ask your question? Ayo Ajibola, kindly unmute and ask your question.
Hello, good evening, everyone.
Good evening.
If you can hear me, the question is, sometimes when you have this ongoing urine or urination, when you urinate and it's not stopping at the right time, or you have your groin paining you when you've taken enough water. Take, for instance, I do take a lot of water. When I say a lot, I mean a lot. And sometimes maybe when I'm pressed and I can't get to the toilet in good time, I have that pain coming on in my groin. That's a sign of what? Or how can we explain that, please? That's my question.
Thank
I
you very
appreciate
much.
all your presentation this evening, madam.
Thank you very much.
That's my question.
Okay.
Thank you very
Okay.
much, sir.
Okay,
Yes,
Pharm,
sir.
please over to you.
Okay, thank you very much, sir. Like I
Hello?
said the other time, that when you are having dribbling, that is when you urinate and you expect it to stop and it's not stopping, I can assure you there's a prostate enlargement. You are not really having big issue because probably it's just starting. And I also mentioned the fact that when you are having pains in your groins and your thigh, that there is need for you to know that your prostate is already having issues. So I will advise that you start on the supplement immediately, and you will definitely see a lot of changes because they are anti-inflammatory agents, and so they are going to bring down the inflammation that is there.
Thank you very much. Thank you very
Yes, ma'am.
much. Mr. Ajibola, please, can you confirm that you are okay with her response? Okay, I think some people will not want to raise their hands. So please, you can type your questions in the chat box, chat room. I will go there now and see if we can get your questions in there if you do not want to come up and ask the questions. Okay, how do you get the supplements? Please go back to the person who invited you, to the person who gave you this Zoom link, and ask the person how you can get the supplements. We have a hand up, but before that hand up, Mr. or Miss Ojowosu, before we take your question, we have a question here. It says, oh God, I hope it hasn't gone. It says, okay, you missed a part in the response. Okay, please get back to the person that invited you. I'm sure, but if not, you can just send me a direct message so that I'll know which part you missed. Is it true that if a man doesn't ejaculate frequently, such a person is prone to having prostate issues? Is it true that if a man doesn't ejaculate frequently, such a person is prone to having prostate issues?
Ejaculation is very necessary for men. And so if you're having difficulty in ejaculation, the thing is, are you having pain when it's coming? And these are the questions that are going to be asked. So when you are actually having pain and it's so difficult for the semen to come out, then definitely there is an inflammation in that prostate. You know, when, let me use this to explain. When you look at a tube, or let me say a pipe, when it is inflamed, you know, the hole inside the pipe will be reduced. It will not be the normal size again. So when there is an inflammation, you will discover that it will be difficult for you to urinate. The urine will not be able to pass through because the space it's supposed to take has been reduced. That is inflammation. And that can only be caused when there is a prostate issue.
Okay,
so you
thank
need to
you
go
very
on the
much.
supplement as well.
Okay, we have another question again. The person says, okay, so I think that this has answered. Okay, well, let me just ask it. Can regular sex prevent prostate problems? And someone says, if a man decides not to have sex, is there any problem with that?
The two questions, I will take them together because they have to do with sex.
Okay.
Now, when I was talking about the cause of prostate problem, I'm sure I did not mention that sex, whether having sex or not having sex, will cause it. What we say is that the cause is unknown. So regular sex or not having sex does not actually have anything to do with the prostate. It has to do with the person himself.
Okay.
So whether you're having it or you don't have it has to do with your mindset. It has to do with you. And you need to sit down and look at it. Why are you not interested in having it? But remember, I also mentioned the fact that when there is a prostate issue, there will be reduction in desire to have sex. So it's a two-way thing. It's either you have a problem with your mindset or there is a prostate issue. So you need to consider the two to know what to do.
Okay, so we'll take those now whose hands are up. So I'm going to be asking Ojo Wosu, please unmute and ask your question. Are you still here with us? Please go ahead and ask your question. Okay, I think he's not here with us. Dr. Fome Onoge, please unmute and ask your question. Your hand is up. Please go ahead.
Good evening, everyone.
Good evening, sir.
Yeah, I've been a regular in your presentations, and I must comment that all the speakers have really done well. Flawless, really flawless and very clear presentation. I'm a medical doctor. I'm a family physician at the same time, also lifestyle specialist. I just wanted to address, there's this background noise. Where is it coming from?
It's coming from your end.
Are you sure? Hello?
Okay, please go ahead.
Okay. One of the, I think the second person, Mr. Jibal also, who asked a question about him drinking a lot of water and the growing pain he has. I just wanted to advise that in as much as the supplement has, there are very beautiful things about this supplement, okay, that takes care of that. I also give out, I'm one of your distributors of the Rain Soul and all that. And I've had extremely very good testimonies about it. I just wanted to say that it would be nice if he could, I don't know how old he is, but if he's over 50, if he could see a urologist so that they rule out other causes of what problems he's having, okay? But that still does not rule out the fact that those supplements are important. They are very, very important. Thank you.
Thank you very much, Doctor.
Thank you, Doctor.
Thank you very much.
Yeah.
Thank you. Okay, so do we have Ojo Wosu? Are you ready for your question? Ojo Wosu.
Yeah, good evening.
Good evening.
My question is, for how long do you have to take the supplements? Assuming I start taking it now, and I get some relief after maybe 4 weeks, do I still continue to take it? Hello? Hello?
Yeah. Okay, yes, we are hearing you.
Okay, that's my question.
Okay, now, for how long do you need to take this supplement? You said, assuming you have good results by 4 weeks, should you stop? First of all, I want to say that, I said they are supplements and they are food. That question is just like you asking me, for how long should you continue to take food? That probably when you take food now and you are filled, then you don't need to take food again. Definitely, you get hungry again and again and again. So now, this is what I'm trying to say. The supplements are very good. They're going to help your body. And for you to begin to have results depends on how your body takes the supplement. There is need to have a particular level of supplement in your body. It's just like when we give also drug medications as well. There is a particular level we will want to obtain for a quantity of that drug that has to be in your bloodstream for it to be effective. So the same thing with this supplement. There is a particular level or quantity that has to be in your blood. And the way your body responds depends on your body, because our body makeup differs. Our response to external stimuli differs. The way my body will respond may not be how fast your own body will respond. You know, it depends on the body. And also there is another thing we normally advise people. How long you take the supplement depends on how long you've had the issue. So we say, let's say you've had the issue for like 3 years, we will advise that at least you take it for the first 3 months. And there is nothing wrong with a maintenance dose, because it is actually a supplement. It is food for your body and it helps your body a lot. So when you take it, it's not just for that thing you are taking it for that is helping you for. It also helps you for several other things in the body, and it helps to keep your body organs functioning right. Thank you.
Thank you very much. Okay, so we have 2 more hands, but before I take those with their hands up, I'll just quickly read some of the questions we have in the chat box so we don't lose them. One of the questions says, how long do we need to take the supplements? You have answered that. How does one use Sol and Core for prostate? Another one says, what is the right dosage for prostate issues? So I think those 2 go together. Can regular sex prevent prostate problems? That has been answered. How can we get the recorded video? That has been answered. How long does one need to take the supplement? That has been answered. So can we just have answers to those 2 for now, and then we'll go to those with their hands up.
The 2 questions they go hand in hand. And you said, how do you use it? Number one, it's you know, rain products are liquid. So you have unfortunately, I don't have it close to me here. You have the pouch or sachet, you shake it, you tear it. You need to shake it because like Rain Sol has the seed particles inside it. So if you don't shake it well, they may settle at the bottom. So you shake it, you tear it, and you drink it. Now, talking about how to use, I mean, I don't want to use the medical word of dosage, but that will give you an idea of what I'm about to talk about. Now, it depends on extent of damage. And so that's why we will not just tell you to go and use the supplements. We will actually ask for a test. So when you give us a test, we look at it and then we will tell you, okay, you might just be okay with 1 core and 1 Sol, or there will be need for us to increase the quantity. Might be 2, might be 3, depending on how much damage has been done to the body. So I will advise that you go back to the person that invited you here so that they can link you up with senior partners and some of our medical personnel, and we'll look into it and we'll be able to advise you better. Thank you.
Thank you very much, ma'am. Okay, so I have hands up. I'm going to call on Mr. I think, yes, Mr. Yinka Adebi. Please, can you unmute and ask your question, sir? Okay, I think he's gone off. Can I have Peter Okoye? Please, can you go ahead and ask your question? Can you unmute and ask your question, please?
Okay, thank you very much. Good evening, everyone.
Good evening, sir.
Yeah, my question is, okay, right now I've been on Sol for about 3 months, and the answer on not having sex is like I'm not satisfied to produce semen. Just like you produce urine and you don't remove it, are you telling me there won't be problem? For me now, sometimes, all right, for some days, maybe in the morning, I find out that semen had come out on its own. How do you explain that? Thank you.
Thank you very
Thank
much,
you very
sir.
much, sir.
You know, it's just like when a woman that is not pregnant or is not a nursing mother is seeing milk coming out of the breast. You see, the production of semen and breast milk has to do, one, with your mind, and two, it has something to do with the brain. So if you are actually seeing semen dribbling, then that means the desire and the desire to have sex is there. And when it is there, it will be produced. And when there is problem with the prostate and it cannot, you do not ejaculate to bring it out, it will find its cause and find a way of coming out. So if you have just been using Rinso alone before, I will advise that you add Rinco to it. That will help a lot, and I'm sure it will be sorted out. And secondly, I will also say, have you done any examination? Have you gone for checkup to actually see the state? Because there's no point in doing a blind treatment. We need to know the state, how far the product has helped you. How was it before you start using Rinso? So all those things will be considered to actually be able to answer your question very well. Thank you, sir.
Thank you very much. Okay, I have some questions before we go again to Mr. Yinka Adebi. He's back. Is it true that if a man doesn't ejaculate frequently, such a person is prone to having prostate issues? So I'm just trying, the messages are coming in so fast, so I don't want to miss any. How long? Okay, we've answered this. What's the right dosage? We've answered this. Okay, if a man, can this supplement work for someone who has moving sensation in his manhood? Can long abstinence from sex cause prostate problems? Can this supplement work for diabetes and high blood pressure?
Yes, the supplements can work for diabetes and high blood pressure. So when you take them, they help a lot. You can get back to the person that had you, and they will be able to put you through on how to use it. Now, we're still back to this sexual intercourse and ejaculation and prostate.
Yeah.
They all go together. I've said it when I was talking about problems that you can have with your prostate. I said one of the problem with prostate will cause is the issue with libido, the issue with ejaculation, and also the issue with sex drive and desire. So if you are actually having all these things, you need to check the prostate. And if you are abstaining from sex, I wouldn't know why, as an adult person, you are abstaining from sex. But then if you are abstaining, if it's just for a short time, fine. Because all these muscles need to be working. You know, the penis and the reproductive organ of a man is actually full of muscles. And when you are having sex, you are actually exercising those muscles. They need to be exercised for them, for the muscle tone to be right. So it's necessary to have sex once in a while, It doesn't have, you cannot, if you are, age determines how often you have it anyway, because when you are growing older, you won't be able to have it like you used to have it when you're younger. So definitely, prostate has something to do with your sex life. So when you are having issue with your sex life, anyhow the issue may be, there is need for you to check your prostate. And these supplements will help your sex life, because when you wake up in the morning and you see that you are okay, the desire will come naturally.
Thank you very much, ma'am. Okay, so so we'll take from one of those whose hands are up. We'll have to move very fast now. Mr. Yinka Adebi, please unmute yourself and ask your question.
Okay, thank you very much. Thank you for the presentation. I'll make the question very, very brief. I just seek some clarification. I assume for supplements, there can be overdose. That's my first assumption. Then when we talk about the frequency of waking up overnight to pass urination, is it, let's say, in a period of 6 hours sleep? Which one is, how do you determine that is no longer healthy? Is it once, twice, 3 times? Those are just my two.
In a period of, in the period of 6 hours, just once would be appropriate. But also I want us to know one thing, that it is not only prostate that can make a man to be urinating too often. Diabetes can as well cause that. So that's why there is need for a checkup, because it might not just be prostate, it might be diabetes. So there is need to actually check to be sure it is prostate or diabetes. And that determines how the supplement is being used. I'm sorry, your first question, can you please repeat it again? Hello? Hello?
Hello, hello.
Yes,
okay. You said his first question had to do with he was asking if I get him right, he was asking that, can you overdose on the supplements? Was that what you asked, sir?
Oh, yes.
Yes, I think I've been allowed to unmute now. I think that's what I asked. I said that, can there be an overdose?
There is no overdose, sir.
Great, thank you.
The supplement is okay and good for the body. No overdose.
Thank you very much. Okay, Ajani Adeolu, please can you unmute and ask your question? While we're waiting for Ajani Adeolu, there's a question here. It says, can the supplement work for someone suffering for 0 sperm count? And then someone says, can the efficacy of this supplement be a substitute for prostate excision through surgery?
The supplements can help somebody that has 0 sperm count. It sure will help somebody that has 0 sperm count. Are you still hearing me?
Yes, we can hear you, ma'am.
Because I could see my internet is fluctuating. Then the second question was,
can it be a substitute for prostate excision through surgery?
We cannot say it will be or it won't. It depends on the body of the individual. It depends on the body. I've seen someone that did not go through surgery and use the supplement and is okay. And I've seen several that went through surgery. But after surgery, they went on this supplement and it helps, 1, fast healing, and 2, to sustain them. You can hear what Daddy or email said the other time. He did surgery, but he didn't have any issue again after the surgery because he has been on this supplement. So the supplement helps to maintain. It was just like when we were talking about fibroid, that after surgery, you find out that the fibroids come back and start growing again. But when you go on supplements, it helps to keep you okay.
Okay, so we're going to take these 5 people now. Please, nobody else should put up their hand because of time. So Ajani Adeolu, please unmute. iPhone, please get ready. I don't know who that is. Okay, Mr.
Okay. Good evening.
Good evening, sir.
Good evening.
Please, I'm not trying to draw us back, but I was in a meeting before and I joined so late. People have been asking questions before I joined. So I just want the introduction of that supplement the more so that I can have the idea of the supplement. And I want to ask the question, I've been using one supplement before, which is, I've forgotten the name. I will remember it later. But can I combine this with that one?
Okay, thank you. Okay, so
what did the
what I will
price
advise?
How can we get it bought?
Okay, so because you joined late, Mr. Ajani, I will advise that you go back to the person who invited you. They will give you the recording. They will give you the recording so you can take your time and go through and listen to the whole talk from the beginning. And also speak with the person about the prices and how you can get the supplements. So Pharm, please can you answer the question, the other question?
Ma?
Pharm Wuraola, please can you answer the question?
Okay.
Sorry, what was the question? Because my internet
was
went
asking
off.
if
I just came back.
Okay, was asking if he can, that he's taking a supplement right now, and can he combine these supplements that you're proposing that we take, Soul and Core, with the
with another supplement? We need to know which supplement is taken. We need to know. But one thing is that, like we said, supplements are food. So, but I need to know which supplement, because there are some chemo supplements. Let me put it like that.
Okay,
there
so
chemo supplements.
Okay,
so I wouldn't know the name of the supplement and what is in it.
Okay,
so probably we can do that.
Okay,
later.
The supplement is Drodat.
Okay, because of time, can I suggest that he gets back to the person who invited
the supplement
him?
I'm using before is Drodat.
Let me quickly answer him.
Okay, ma'am.
Drodat is a drug, sir. It's a medication. It's a drug.
Okay.
So, and this supplement does not affect it. I have a lot of elderly clients that are on Drodat and they are using this supplement. So you can use it.
Okay.
Yes, sir.
Thank you very much. Okay, iPhone, please can you unmute and ask a question? iPhone, are you still there? Okay. iPhone, your hand was up, please unmute. iPad, are you there? iPad, please unmute and ask your question. iPad 2.
Hello.
Hello.
Good evening.
Okay,
good evening.
Go ahead.
My name is Richard. It's like one of my questions has been answered. I want to know the relationship between the prostate and diabetes, because it has some the same symptoms together, like frequent urination. So I know I have diabetes, but I want to know, I've gone for tests on prostate before, and I was told it's enlarged. So now my question is, if I use rain core and the other one, can it also treat my diabetics?
Yes, it can. It will take care of the two cases. So, you know, like you said, both of them have
same symptoms.
Frequent urination as symptoms. So it will take care of it, because when you have frequent urination, like I said, except you go for a test, we cannot say, okay, this is what is causing it. You need to actually do a test. So, but Raincore and Rainsol will take care of both at the same time. And that's the beauty of this supplement. That's the beauty, because when you are taking it, it takes care of several things in your body. You will see, you can mention like 20 different disease cases, and we will still tell you take Rainsol and Raincore. But just that the way we will tell you to use it may differ from one case to the other. So definitely it will take care of both.
Thank you, ma'am.
Okay. Thank you very much.
iPad 2, please unmute. iPad 2, please go ahead.
Hello.
Hello. Hello, good evening.
Good evening, how are you?
Very well, thank you.
Yeah, my question is, can you use the soul and a core and a red soul at the same time? And second question, do the supplement have expiring date? On the one I'm using now, there is an expiring date on it. But I want to know whether supplement can be expired or not. And second, whether you can mix all the three or the four at the same time. Thank you.
Thank you.
Thank you very much, sir. You can use all of them together. You can use all of them together, and they have expiry dates. If you are in Nigeria, they even have NAFDAC number. That is, they are satisfied by the health bodies in the country. So they have expiry dates. They need to have that because they are natural, they're pure, you understand? They are just cold pressed, okay? So there is need one for that expiry date to be there. So just to be sure that you are still getting the exact nutrient that is in the product.
Okay. Abiola Shegu Williams. Please, can we, please, nobody, no more hands up, please. It's already 9:38. We said 1 hour, 20 minutes. We don't want to overexceed the time. Abiola Shegu Williams, please, can you unmute and ask your question?
Thank you. The reason why I'm asking this question is because I don't think it was completely answered when it was asked. Someone had many people had asked about abstinence and prostate problems. And the lady, the doctor or the pharmacist that was answering our question said that, why should you want to abstain anyway? You could want to abstain, number one, because you're not married. Number two, maybe your wife is sick. Number three, maybe your wife is dead. Or because you have to abstain because the Bible says so. Now, are you saying that abstinence is not practicable for any man because the muscles of the prostate or the muscles of the testicles will hurt the man? So, I mean, in other words, we might be justifying the reasons why some men do not exercise self-control and they take liberties at sleeping with anybody. They are house help because their wives are not available, or practice rape or incest because they can't control themselves.
Okay, sorry, Mrs. Shekun Williams. I think that, okay, well, I'll allow Pharm will answer the question.
No, go on first. Go on first. Before I speak.
Okay, so what she's explaining explaining is in context with a man who has prostate issues. We are not in any way in our organization condoning, supporting, or promoting anything illicit, anything illegal, anything that is not morally right. That is not why we are here. We cannot, and we will not do that. He was answering the question in relation to a man who has prostate issues or who thinks he has prostate issues. And that is what it is. We will not in any way promote rape or any of those things you are mentioning. Far from it. That wasn't even. I'm even quite surprised to hear this question because we are here for a. It's just that when you go to the hospital and you are given treatment, it's because of the issue that is being addressed, not because of the things you're talking about now are things that have to do more with moral issues and more with behavioral patterns. And there's no way we will ask you as a man go and sleep with another woman or go and sleep with your household or go and rape somebody. No, if you have a medical condition, it's a different case. If you are a Christian or a Muslim and you are fasting, then we know you are fasting. So you will not be coming and saying, "Oh, I'm not able to have sex because I'm fasting." The two don't go together. You already know that you are abstaining. You already know that you are fasting. So the issue of you having medical problems is not the reason why you are not doing what it says that you are not doing. If you understand what I'm saying. So I just like us to clear that in Rain International, we do not in any way promote any of the things that you just brought right now. I mean, it's I mean, I can't believe that question came up. But hey, Dr. Pharm, please can you also throw some light on this?
I think you have answered it very well, because what we are talking about here is medical conditions. And because it's medical conditions, so we cannot bring it into religion or bring it into desires and all those things. So you've just given the right answer now. Thank you.
Engineer Aguka, please unmute and ask your question. Thank you. Engineer Aguka, please.
Okay, yeah, can you hear me now?
Yes, please.
Oh, okay, yeah. So good evening, everyone. And thanks to the madam that took us through that gave us an intuition into the topic for today. And thanks to everyone that has contributed immensely to the course of this. So mine is just a little bit of clarification. I remember the presenter did say something about the supplements and the ingredients used to make up the supplements. I just want to just to have a reassurance. I'm aware that some diets are best we have some diets that are best recommended for some blood group types. As we're all aware, we have the A, the B, the AB, and the O. So it's not as if people do not take this, but sometimes when you take this, you might have it might compromise the blood group type in terms of its metabolism and also cause fluid retention, fatigue, and all whatnot. So in making up this supplement, were these ingredients considered for the different blood types, or it doesn't really matter, irrespective of the blood group? Thank you.
Thank you very much for the question. It doesn't really matter. It doesn't affect the blood group because these are natural supplements. You see, I think we need to understand the fact that there is chemo supplement and there is natural supplement. It's like asking if orange is good for some blood group and it's not good for some blood group. I don't know if you understand me, sir. So this supplement is good for everybody, no matter what your blood group is, and it has even helped genotypes, especially the sickle cell genotypes. It has helped a lot of patients in that category very, very well. Thank you.
Thank you very much, Ma. Okay, our last hand up, Idisire. Sorry if I'm not pronouncing your name properly. Kindly unmute and ask a question.
Thank you very much, man. It's okay. Madam, thank you very much for the lectures. My own is that last week I went for a medical analysis and I was told that yes, I have this prostate enlargement. Basically, I just want to know where I can get this product, maybe in Abuja or in Suleja where I reside. And I want to know how much is the product that I may like to get it so that I can start using them. Thank you very much.
Okay, thank you, sir. So we had said before that for those who are interested in getting the products, please go back to the person who invited you to this session. They will inform you on how you can get the products. Okay, I want to quickly run through some of the questions that we have here that I don't think have been answered before, so that we don't miss out on anybody quickly. Okay, all the questions on purchasing the supplements, get back to the person who invited you for purchasing the supplements. Okay, there's a question here. Is it good to use drugs that will help you to perform better before having sex?
No, it's not good. It's better you use these supplements. They will actually correct. You see, those drugs are not correcting it. They are only giving you the effect, the pleasure you want for now, and they are causing a lot of damages. They are only giving, there are some medical conditions where you will need them. So when you actually need them and you are giving, they are okay for you to use. But when you don't need them, you don't need to go for them. Use these supplements and all things about your sexual life will be corrected.
Okay, thank you very much, Ma. Okay, someone has questions about urinating in the night. We've spoken about it, that you shouldn't be more than once in a 6-hour stretch. If it's more than once, see your doctor, be sure to find out what is causing it. Like we have learned, it can either be prostate issues or it could be diabetes. There's another question here. The PSA result is 7.0. What dosage? I don't know what the person means by that. Do you have an idea?
I understand, but I think it's better we discuss behind this.
Okay, so Mr. or Mrs. I don't know, Adenuga Taiwo, please get back to the person who invited you and let them know that Pharmacist Wuraola said you should have a direct discussion outside of the Zoom with her so she can address this issue properly. How do you draw a line between someone on high blood medication, which invariably after a period of time causes low sex drive and prostate? That's the question.
One, we need to know which of the medication the person is using.
Okay.
And there is need to actually do some examination. I don't like to just give a blind treatment.
Okay.
It's not.
So this person as well that asked this question, please get back to the person who invited you, and they will set up a meeting with you and Pharmacist Wuraola. Can the supplement help in prostate enlargement? Yes, she has answered this question before, that the supplements can help. What are the effects of radiation as a remedy on the patient with prostate cancer?
Effects of radiation, there could be, it depends on the body of the person, because individuals have different reactions to chemo and radiation. There are several kinds of reactions that you can have. But the beauty of it is that even when you are having chemo and you are having radiation, you can still use the supplements and they will help you to scale through whatsoever effect they might have on you.
Okay. Thank you very much, ma'am. Apart
Yes,
from
ma'am.
winter time, is regular night urination a sign of prostate? That has been answered before. We have said if you're having frequent urination, you need to see your doctors to do a proper examination, ask the right questions, and know exactly what is causing the frequent urination. Are the ladies talking consultant urologists? No, we are not. I am hosting and coordinating this Zoom session. I am a wellness and I'm a wellness consultant. I am not a consultant urologist and pharmacist. Uraola is a pharmacist of over 34 years. The meeting started by 8 p.m. and you can get a recording from the person who invited you for this meeting. Please give us the names of the supplements again. They are called Soul and Core. Can these supplements cure prostate enlargement? How does Rain Soul compare with Cordyceps militaris?
We don't use the word cure, but I can assure you it will be of great and tremendous help. Great and tremendous help that you will really thank God for. And they can help with any kind of condition. Just take it, because one thing is that Rain Soul is going to boost your immunity. And like I said when I was talking, when the immune system is boosted, your body will naturally fight any form of disease or infection in your body.
Okay. Thank you. So I'm looking to end this session today by 10 p.m., which means we have 9 more minutes. How does Rain Soul compare with Cordyceps militaris? I don't know if that is something I don't know what that is.
That's what I was trying to say the other time, that it can also be used because it's going to boost the immune system of the person. And when your immune system is boosted, your body will naturally sort out any kind of problem it has. So Rain Soul can also go for it.
Okay. We have one last person whose hands are up. Okay. Okay, quickly. Do BP medications affect erection? Please, can the supplements treat premature ejaculation? Okay, so I think those are the last two. Okay, we have Mr. Achibola who asked a question before. His hand is up. Is there something? Please type it in the chat box, sir, because of time, so that we can, these last two questions, please can you just answer them and then we can call it a day. Do BP medications affect erection? Can the supplements treat premature ejaculation?
Can BP what, sorry?
Do BP medications affect erection?
Oh.
And can the supplements treat premature ejaculation? For all those who want to get the products, these supplements, please get back to the person who invited you, whether you're in Nigeria, in the UK, in America, in Ghana, in Canada. Rain International is in over 47 countries worldwide. So yes, you can buy in the UK to the person who is asking, but please go back to the person who invited you. Mr. or Mrs. Ade Adeshola, please go back to the group where it was posted and the person who posted it there, please contact the person. I'm sure they will be able to give you feedback. But yes, you can buy in the UK. So please, over to you, Famuraola. I'm sorry, Mr. D. We cannot take any more questions. Please type it in the box and maybe in the chat room.
Yes, some BP drugs can actually affect the ejaculation and libido. So, because most people that have BP also have some other underlying diseases and infection. And it's very likely such a person is not using only BP drug. So there is need to actually go for a checkup and be sure. When it is affecting your libido, such drugs are withdrawn, and there will be some other drugs that will be given. There is no drug that doesn't have its own side effect. And some people may not even be affected by the side effect, and some people will, the side effect will be aggravated in their body. So yes, it can. I think, is that all?
Okay, yes. Okay, Mr. Ajibola, the guy who asked the question, the very first question, he says, I had cyst surgery some years back and urinate 4 times in the night. Mr. Ajibola, you have been advised to please go to see a urologist and to get an accurate diagnosis. So that does not mean that you cannot still take the supplements. The supplements work with whatever medications that you are on to boost your immunity and help your body repair itself faster. And then Mr. D says, yes, Mr. Akintewe, you have our permission to leave. Thank you for, we're actually rounding up now. We are closing now. Do you recommend taking both Sol and Core together to boost sperm counts?
Yes.
Okay, and then the answer on premature
more
ejaculation. Please, can you answer that one as well quickly? On premature ejaculation.
Yes, I said the supplement we have, I remember.
Okay.
I answered that the supplement we have, and that person should also take both Sol and Core.
Thank you, Ma.
You're welcome, ma'am.
So do you recommend taking both Sol and Core to boost sperm counts?
Yes.
Yeah.
Please.
Okay, thank you very much, everybody, for your time. We have come to the end of today's session. Wow, we spent much longer than expected, but it was worth it. It was really worth it. I have learned a lot for myself. I know for the men in my life, and I'm sure we all have as well. Thank you very much once again, Mrs. Wuraola, for today's presentation. It was really awesome. We want to wish all our fathers, all our brothers, all our sons, all our husbands, all our men in here, happy Father's Day. Like I said at the beginning, this presentation was put together in honor of Father's Day, which is coming up next week, Sunday. So we wanted you to know that we care about you, we care about your prostate health. I know a lot of men don't like talking about it, but we decided that it was something that we need to demystify and come to know how we can address these issues as naturally as possible. So like I said, if you're interested in this supplement, please go back to the person who invited you to this presentation, the person who gave you this Zoom link, go back to the person. For those who Pharm Wuraola says she would like to know more about what the issues are, please go back to the person who invited you and tell the person that that was what she said, and they will have they will connect you with her so that you can have more discussions. If you want to buy the supplements, get back to the person who invited you. Thank you very much, everybody, for your time. It is 9:58 here in Lagos, Nigeria, and 9:58 in the UK, and whatever time it is in other parts of the world. Thank you all very much. Good night. Have a wonderful evening. And we look forward to having you at our next Wellness Summit, which will be coming up very soon. We will keep you posted. Thank you very much, Pharm Wuraola, for your time. God bless you. That was really awesome.
This. I
very,
appreciate
very
you.
informative. Thank you all very much. Thank you very much.
God bless you, ma'am. Bye, everyone.
Bye-bye. Thank you.
Well done, Honorable.